Good morning. Thank you, Chairperson. And first of all, I would like to thank the organizer to give us an opportunity to be associated with this conference and to present what we are trying to do in the field of occupational health. Both of us, we are not researchers. We are occupational health specialists working with business conglomerate to help them establishing their occupational health practices as well as help them to identify adaptation to the challenges, whatever it comes. One of them is climate change. So what we have planned today is that a very brief about what is Aditya Birla Group for people who are new to this, and then what was the threat. It's not looming, it's at doorstep now about climate change, and then what challenges we faced, what way we found out. We developed some concept, and then we did proof of concept. We'll share it with you. And yesterday, with session yesterday from Dr. Das, there were so many things which were clarified, made our work easy, and which we need to explain to our management so many times. So that was really nice. Thank you so much for that. So about Aditya Birla Group, we are $66 billion company in 6 continents with 210 manufacturing locations across 40 plus countries and 190,000 employees now across the group. There are direct employees, there are indirect employment as well. And we are in almost 18 different sectors. At few sectors we are number 1 in global, and few number 1 in India. Few sectors we are yet emerging. You might be aware about few of the brand names: Pantaloon, Louis Phillips, Peter England, Van Heusen, Ultratech Cement, Hindalco Aluminum Foil, and then Vodafone India, Idea, so on. So this is what is Aditya Birla Group in a nutshell, where we are working at a corporate office. So climate change and health. So there are many news in picture. Again, thanks to speakers yesterday, we don't need to explain too much around this. It's not a looming threat, it is there at our doorstep. We really recognize this, and we are supposed to find out ways and means for our company, what we are going to do with this. As far as health effects are concerned, so we develop in this way. There are 4 factors leading to other 8 factors leading to around 12 or 16 health impact. So why I am showing this over here, not for the sake of repetition, but to show that we had to deliberate out of this health threat, which are in our control being organization. So there are few threats we can control within our own boundary, and there are few threats which we need to work out with public health agencies, maybe government agencies, where we need to work with them. So we identified them and we came along. But there were many challenges. One of these is a human growth population. Why I am showing this to you? By 1930, we were 2 billion on this earth. And it was calculated that by 2028 will be 8 billion. We are already 8 billion now. Okay, so we have beat the expectation, 8 billion people on this earth. What it means that a city of size of Udaipur is a big city here in Rajasthan, is being added on this earth every week. This is net of birth and death. What does it mean? It has an ecological footprint. Basically, it means that if everybody desire to have an equal upper middle class life, for resources we require 4 earth, and 1 earth is not sufficient. And to add into this, half of the people are living in this circle, and India being one of them. So apart from climate change, this is additional challenge for us, even as a corporate and organization, to deal with, because this concentration of people gives us additional challenges as far as employment is concerned. The another challenge was just sheer spread of our organization, spread in terms of different manufacturing processes, different geographies, in hotter countries, in colder countries, in developed countries, in underdeveloped countries, or developing countries. the socio-economical background, the kind of burden our people are coming with it. So we have to deal with them. So that was another challenge. So what we did, as a group sustainability cell, we actually did a complete research for the risk assessment of our plants. What are the physical risks are there? Whether it is extreme weather event in terms of whatever climate change and its impact, not limited to health but the overall. So we analyzed over our 248 assets, which has a revenue, which has a financial exposure for around 47 billion pound or euro, you can say. And with this research, we identified that as far as health impact are concerned, we have around 5 areas which is under our control as far as industries and occupational health is concerned. So we can work around this, at least as an organization, taking care of our people within our boundary, within our township, and maybe in a surrounding village where we can influence and work around with them. So these 5 areas we identified. One of them is vector-borne disease. Yesterday we had a very good discussion. Thank you very much for that. And we are actually looking for that, how do we influence our decision maker about this additional, apart from heat stress everybody understand now, but for vector-borne disease. And the problem is that our factories which were in cooler area initially, their winter is becoming warmer and becoming more conducive for vector to develop, and therefore the disease which were not there, malaria was very prevalent in India, is very prevalent in India, dengue is very prevalent in Thailand, but the other area, northern area, where it was not there, it will coming up. So we have to be ready for that. Another is around food and water. This is going to take a wet drought and dry drought. So there are multiple implications, but ultimately it will lead to malnutrition or waterborne disease. Malnutrition in form of undernutrition, overnutrition, and waterborne diseases if the things are not being taken care for our facilities where we are working. The another is mental health. Again, I have taken privilege. I have taken a chance to give a photograph of Dr. Das. Yesterday, those couple of slides were very nice around impact on mental health. We really recognize this in our study. And ultimately, it comes to heat stress. Okay? So these are few areas what we identified that we can work within our own boundary as an adaptation measure for the health impact of climate change. So, kind of corporate slide, but what we tried, we picked these 5 areas, we developed standards at our corporate level. Standard says what to do. So we define what we want to achieve in each of these standards dealing with these 5 areas, and then at each business, we have different 16 businesses. So each business level, we have developed the governance structure around this, which in turn is going to monitor how it will be implemented in form of procedures. So when procedures are developed at site, it tells what to do, how to do, when to do, who is going to do, how it is going to get reviewed. So what is decided at group level and site level, how, when, where, everything. So it's a very structured method we try to develop across the group. We are not saying that we have reached a maturity level. We have developed this. It has gone to some extent. We have got a good result and effect around this. And we are in the process of gaining maturity. But this is what the journey we have started. So out of these 5, today what we are going to focus is around heat stress. The last one. That is what we are going to focus, that what we did around this. So coming to heat stress at workplace. Yesterday we discussed this. In India, 2023 was the hottest year. Now it has come 24 is the hottest year, more than 536 heat wave days last year cumulative across all the states. And this year, yesterday I was discussing with somebody, Mumbai, the orange alert is already there. We are yet at the end of February, which is considered to be cooler month. And the orange alert is already declared in Mumbai. So that is what we are expecting this year also. It has a potential loss of 219 billion, and in India, 191 billion man-hour is going to loss. As an organization, we can't afford this. Okay. So therefore, this was a need to work around heat stress. What were we trying to achieve for heat stress? It prevents heat stress incidents. We don't want any heat stress related illnesses and incidents. So for that, we have to identify high risk activities or high risk areas. We have to identify high risk workforce who are more vulnerable, have personal factor to be vulnerable to that workforce, and then we need to implement control. We know this for the effect of heat on human being. At workplace, there are 3 different set of factors. One is workplace related factor. The another is work related factor. So workplace related factor is all conditions, work depending on the pace of the work, the kind of the work they are doing. There are many personal factors. So whatever effect will come on human being will be a cumulative of all these things, whatever is present. So we need to devise a strategy we take care of majority, at least if not all, majority of these factors. How we are going to do? Then we again got a challenge. There are so many tools available across globe. So many tools. We studied many of them. Like if you talk about heat index or humidex, this is the table. This is the classification for high, medium, low risk or very high risk. That is one tool or 2 tools in fact. The another is WBGT index. In our studies, we came up with WBGT index. We keep studying WBGT and using WBGT across our workplaces. It takes care of 3-4 factors. We also studied TWL, thermal work limit. That is being widely utilized in few of the countries. In one of the countries recognized as the official tool. We studied that and then we compared that which tool is taking care of how many factors. And then what we found that all tools are having their own limitation. And none of these tools is complete in nature by itself to take care of our challenge. The other thing, if you see WBGT, in WBGT, whenever the WBGT index come around 30-31 degree, we have to close our operation. So in that case, in India and Southeast Asia, I have to shut 70% of my factories or activities in factories. But they are still working. They are working without major incidences. That means I cannot use WBGT directly. For my factories in a cooler area, USA, Canada, North Europe, this is still applicable. But if I take about Gulf countries, India, Southeast Asia, I cannot use WBGT. So what we can do in that case? So in place of redefining the wheel or re-identifying the wheel, what we did, we identified established tools and then we made a process around that. So what we decided, what concept we developed, that first we have to do qualitative exposure or risk analysis for all our workplaces across the factories, all our workplaces and all our work practices. Those workplaces or work practices which come as a high risk by this qualitative tool, will subject them to quantitative tool using TWL meter, which takes care of majority of the factor. Wherever the risk is high based on qualitative, we will go for quantitative. And wherever there is a high risk coming out of quantitative, we still cannot shut our operation and have a production loss. So we will subject them to physiological monitoring. By doing physiological monitoring, we will identify people who are more vulnerable and more susceptible to develop the heat stress effect. And then we remove them and we keep monitoring them throughout the summer. So we have decided from 1st April to 15th of June in India, we will keep running this cycle. And I don't know, based on the news yesterday, we might have to start in 15th March this year. So that is what we developed. So this is the concept what we developed going beyond WBGT. It took some time for us to establish this. And then now we have developed technical standard around this, but before that we have to do POC, whether this works or not at our factories. So this is what we have done. Now POC was done at our 10 of manufacturing locations. It is personal work done by Dr. Sunil at ground level for each of the factory, each of the minute detail. So for the remaining part, I will request Dr. Sunil with me to explain you going forward. Thank you.
Manufacturing locations in India. During our summer months, so we have started with giving more education, trainings to required personnel like health personnel, safety personnel, management, how to do and what to do. Then we did POC at our 10 locations, and along with that, toolbox talks at all our locations. That is very important to aware all the workers, supervisors about heat stress. So that is ongoing program throughout summer. And there are other lot of activities like we have find out lot of control measures how to improve our workplaces. So I will go through one by one. Trainings we have started with emailers from January onwards regarding our approach to the management, to the safety and health people, so that they can understand that this is going to this is what we need to do. Then we did classroom trainings, online trainings regarding qualitative assessment, quantitative heat stress assessment, and then for physiological monitoring, of course. So these are the factors which we have considered for doing qualitative assessment. Each factor which are mentioned here, 15 factors we have considered because they are directly linked with heat stress. Each factor is linked with the score. And the total score, out of this total score, we categorize them into high risk, moderate risk, and low risk. So wherever we find high risk, we need to do step 2, that is quantitative assessment. And during this qualitative assessment, we did it in our 56 of sites, because this is qualitative. With the training, health and safety personnel can go to the workplaces and do this qualitative assessment. So 56 of our manufacturing locations, they have done this assessment at our more than 1700 workplaces or activities. And you can see the red colored one are high risk activities or workplaces out of total. Now here we need to do quantitative assessment. So now that is already we explained by TWL, thermal work limit. This is how we did. And at our 10 manufacturing locations, now you can see the first figure is 271, 160, 47 and 45. These are the workplaces or activities at the sites at 10 locations. So first, these are the business-wise locations I am taking you. Red one is business 2, which is mentioned here. I'm sorry, it is not working. So business-wise, we have divided into 4 categories. We took 4 cement factories, 4 metal factories, 1 chemical factory, 1 fiber factory in India. Sorry. Yeah. So this is the workplaces or activities we have identified. These are the numbers. We did qualitative assessment into these number of workplaces. We found high risk in qualitative assessment in these numbers. So out of 271, 153 workplaces were found high risk in qualitative assessment. So we went for quantitative assessment in those high risk workplaces, and this is the result. So the objective is, because we have big site, lot of people are working, we need to identify high risk workplaces where heat stress can be more prevalent. So we have to funnel it down from whole factory to few workplaces, so that we can focus on those areas for workplace improvement, focus on those people working in those areas, so that we can protect them. So these are the workplaces or activities we found more vulnerable for heat stress. Now we'll go into more detail of this. So 4 cement factories. This is the qualitative heat stress assessment done at 4 sites. Out of 160, we found 76 in high risk. And then we did quantitative assessment. Out of those 76 workplaces, we did for 74 because of lack of time. We couldn't do at 2 workplaces, and we found 10 workplaces as high risk. And these are the details of those workplaces. These are the common areas we found that in cement factory. These are the common areas which are high risk areas. But you can see that because of the location and geographically different location and different structure, high risk workplaces are different in all the cement factories. So it is not common across all. Now this is an example of metal industry. These are the high risk workplaces we found after doing qualitative assessment, and then we did quantitative assessment. We found high risk workplaces. So reducing the total workplaces from 271, we found 36 workplaces or activities where we need to focus. These are the details, just for your information. Now this is very interesting, like what I told, that infrastructure is very important, ventilation is very important. This is one site, there are different plants. These are boilers, boiler number 1, boiler 2, there are 9 boilers in the site. And workplaces 1, 2, 3, 4, 5, 6, these are common workplaces across all the boilers. So activities are going on same in all the boilers, but you can see the risk is different. Red is high risk, yellow is moderate risk, and the green one is low risk. Why? Because boiler 1, 2, 3, 4 were built in 1960 or 1970s, and the boiler which is 8 and 9 were built in 2000 or 2010. So they made improvements in infrastructure. Ventilation was much more better in newer boilers than the other boilers. So two things come out of it is infrastructure and ventilation. These are very important to prevent the heat stress. Okay, so these are the fiber and chemical factories where we did qualitative, quantitative assessment. And the third step is, now from here onwards, we have to divide our focus into two parts. One is going into step 3, doing physiological monitoring, and other is, now we have identified high risk activities and workplaces. So we need to identify controls, implement controls, improve our workplace. So we did physiological monitoring of 1700 people, 52 employees we found they are abnormal. So what need to be done is continuous monitoring for next 10 days, education awareness, one-to-one counseling, adjust work rate scheduling. This is very important. If their pulse rate and oral temperature is high, as per OSHA guideline, their work rate scheduling, we need to adjust it. And if on daily basis, if we are finding abnormal, we can relocate that person from high risk to medium risk or low risk. And this is how we identify control measures. You can see, we identified hazard, we identified the risk, we identified engineering controls for each high risk workplace or high risk activities. So at each of our sites, we have the risk management team. So they sit together with the data, with the qualitative, quantitative assessment. Technical people, those are now FH technical or operation people, along with safety and health people, they find out some control measure, engineering control, or meanwhile, means we need to implement engineering control, meanwhile we need to implement administrative control, because engineering control is long-term objective. So this is how we identified control measures. Again, this is of another business, another site. This is of third site. So this is the methodology at each of our site to identify risk control measures, to implement them, to improve our workplace so that we can reduce the impact of heat stress. So identifying engineering control and implementing them, we have huge period of time. So few administrative measures which are must to do at each of our high risk and medium risk locations. So those are work rest scheduling. We have to adjust work rest schedule for each of our workplaces on workers working in those areas. cool ventilated areas. It should be near to the workplace. So it should not happen that worker is working in another direction and rest area is around 200-300 meter away from his workplace. So we need to develop cool rest areas which is near to the workplace. Ventilation, drinking water, ORS, toolbox stocks, acclimatization. This is must to do. We can do at each and every location. These are administrative controls. And then few additional actions if we can do, that is work permit system for high risk areas for non-routine activities, because few people are working in the workplaces which are high risk on daily basis, so they know how to work, when to stop work. But people like maintenance, doing maintenance activity, they are going sometimes into the workplaces doing maintenance work. So for them we should have work permit system to educate them around heat stress. Have workers working pair, heat protective clothing. Yes, so after doing all of this, what is very important is adaptation by businesses, because we are at group office, we are having multiple businesses. So businesses should adopt our approach. So it was well adopted by businesses. And then I'm sharing you just good practices around a few of our sites. Mist fans, which is just outside the workplace, mid spraying, rest areas, and coolers just near to the workplace, and ice waste for the people who are working in high risk areas, and many more. Yeah. Yes, this is very important. From starting from March to June, we need to do toolbox talks for all our employees, for all our workers, with the supervisors. They need to understand the signs and symptoms of heat stress, what to do, whom to contact, when to go, what is our work schedule. So all these things we can deliver at our shop floor through toolbox talks. So on a summary, we did derive into 3-step approach. We did POC to identify, to identify high-risk workplaces, high-risk workforces, and now we are identifying control measures, and it is well appreciated by shop floor workers, because they are our customers. They are working on ground. We need to improve their workplaces, and of course the management. So I'm not sharing this thing because of lack of time. Thank you.
If there are any questions to the speakers. Yes, ma'am, please.
Risk assessment and then quantitative risk assessment using temperatures, and at least 50% of the sites were not included in high risk during your quantitative assessment. So what was the main factor behind that? There's one more question. Did you consider any actions linked to the temperature thresholds at these work sites, and what is your general opinion about these thresholds?
So first question is in my slide. So that is to show that few businesses are more vulnerable for heat stress. So I think 3 businesses which were last into the slide are not having high risk workplaces, because those are the businesses which are workplaces are in the roof with well ventilated area. There is no muscular activity. Like one example is ABFRL. So they are just stitching the clothes. They are preparing clothes out of raw material. So those are not their heat stress risk is, I think, negligible. So, and one site is in, I think, in Nainital. So that site is, it is not, they are not having a high risk for heat stress. So that is there. And another reason is we have started doing qualitative assessment in April month, which is still not hotter. So few of the locations, they have done heat stress assessment in April, and they have not repeated doing heat stress assessment until June. So what we told our site now from this 2025 onwards is every 15 days we need to do qualitative assessment, because temperature is increasing day by day. We cannot do once and we cannot derive that, yes, this is the final result. Another question is about temperature. So in qualitative assessment, temperature is there.
I'll take that second part, is around, it's not about setting up a threshold for a temperature. Temperature is not the only factor. As we discussed, there are multiple factors. Temperature is just one of them. It's a relative humidity, radiant heat, and personal, there are work pace, at what pace, what clothing they are having, and the personal factors. So therefore, it's not possible. In laws, there is a temperature, humidity, there is graph, everything is there, but that's not working according to us. So therefore, we develop this concept or develop this methodology just to take care of majority of the factor affecting heat stress, and therefore we didn't develop that one temperature threshold and use this methodology so that you can identify the potential area where there is a more impact of heat stress. Therefore, it's not required. Thank you.
Yeah, so to complete that answer, I'll come back to it. Did you use a uniform scale or did you have a weighted scale for calculating the risk score? That will answer your question, how much importance you are giving to temperature, how much to humidity, how much to clothes, and how they are impacting. If you have a weighted scoring system, then that will answer the question.
So, I will tell you. So, even for the qualitative risk assessment, the methodology, the score assigned to it for no risk, medium risk or high risk, and the total score and differentiation is already established. We saw that source from where we have taken. They have taken care of this relative score, relative
is it weighted score or it's a simple scoring system?
Sorry?
Is it a weighted scoring system or it's a simple
It's a weighted scoring system, but it's a standardized across all our sites.
Agreed. But then there should have been thresholds. If it is a weighted scoring system, there have to be thresholds in that.
What we understood from the ready-made wheel, what we have adapted is they have given enough weightage to each of these factors. But we didn't go and ask, went back and asked the questions about what they have, because it was already established. But point taken, we can still consider that how much.
Definitely. To keep the schedule on track, the rest of the discussion can be taken at the end of the session, right?
Yeah, thank
Sir, you had a question, please.
Work rest cycle you suggested.
So for TWL, we have used thermal. If we find out high risk workplace and activity is moderate, then work should be 40 minutes work, 20 minutes rest.
Did you suggest?
And 1 minute. And for high risk workplace, and if activity is more muscular, right, then it is 15 minutes of work, 45 minutes of rest. So that is what is written in TWL guideline. But what we did beyond that is we are doing physiological monitoring of people working in those high risk workplaces, so that we can identify, because they are already working in those workplaces and their cycle is already there. So what we did is we identify vulnerable population who are having abnormal findings through OSHA technique, that temperature is going beyond 101.2 or pulse rate is going beyond 110 for 4 minutes. We identified those people. We check their work schedule, we can modify their work schedule or we can modify their workplace. So that is what our methodology is.
We adapted that from both the sources. TWL people have established their science, OSHA has established science, how to implement physiological monitoring. We just adapted and made up.
Your question got answered, I think.
Okay.
Yeah,
Thanks.
okay.
Thank you, sir.
Any more questions? Well, if not, then once again I thank Dr. Naik and Dr. Patel
Thank you.
for this very interesting and